Hello, my name is Rob Orr, clinical myotherapist and credentialed McKenzie therapist in mechanical diagnosis and treatment. Welcome to my consultation room. Today I'd like to demonstrate an exercise that is very specific for a stiff ankle joint. And you could be experiencing stiffness or pain anywhere around the ankle joint itself, and this is quite an appropriate exercise for this joint, especially if the joint feels obstructed or blocked or stiff during certain movements of the ankle. And in my experience, I found this particular exercise can be very beneficial and helpful if there is stiffness in that joint, which normally means, I shouldn't say normally means, but highly likely that there could be a block in that joint called an obstruction, and also called a derangement, joint obstruction. And so I'm going to demonstrate this exercise very shortly. So with this exercise, we never push through any pain, we just go to the very edge of your pain. And just be aware that 43.5% of extremity pain, which your shoulder, elbow or wrist, or your hip and your ankle, does have a lower spine component. Reference to Richard Rosedale et al. 2017, that was published in 2020. Now this exercise itself, I'll show you a progression. So I'll do the basic format first, and then I'll show you a progression to this exercise. If you want to see an exercise that is a little bit lower load to this, you can visit my YouTube site via my website, www.roborr.rehab, and there is exercise there that is not only a calf stretch, but also an exercise that you can mobilise the ankle with in an unloaded position, which means you're actually lying down and doing it and using a towel to help aid the movement. But I have found in my experience, I have had a lot of my patients or clients with ankle dysfunction or stiffness or pain or unexplained inflammation go straight into this exercise and has been quite beneficial. So I'm going to show you this now. So I'm basically got a chair like so, and let's say it's my right side, which is my right side here. I'm going to place my right foot on the chair, as you can see. Now make sure the chair's anchored so it can't move for safety. And my left foot, it's just behind me, and my left foot is completely on the ground, okay? Now when we do this exercise, we normally start at approximately 90 degrees approximately, and then all we're going to do is that we lunge forward like so, and as you're lunging forward, the heel with the foot on the chair cannot lift. It cannot lift. It must stay nice and stable. But your back foot can, if you want to, not a problem. And my back leg is relatively straight, but you can do whatever you want with it, but keep it pretty straight. And I'm going to come all the way forward. Now, if I get pain, don't push through the pain. It could be at the front of the ankle, could be behind the ankle, could be to either side. That is quite common to have at the front, but with a joint obstruction called derangement, it can actually be variable and present anywhere in the ankle. So I go to my point of discomfort, hold for 2 seconds, 1, 2, come back up to approximately 90 degrees or 80 degrees, and I lunge forward again as far as I can. Don't lift the heel, don't push through pain, go to the edge of the pain, or where physically you can't go any further, hold for 2 seconds, 1, 2, and come back. Very simplistic exercise, but highly beneficial for obstruction through the ankle joint or a stiff ankle. And I recommend about 15 to 20 in a row, but if you're a bit cautious, why don't you start with 10 and then reassess it to see if it's any better. What you should notice also, as it's getting more comfortable, you'll go further into range before that discomfort comes on, or maybe it doesn't come on anymore. Hold for 2 seconds, nice and easy. Now I'm going to show you a progression. Let's say you do this exercise and you retest whether it's walking that's uncomfortable or a squat or a lunge that's uncomfortable, and you retest it and it's no better but no worse, then we need to progress it. And there's 2 ways you can progress it. And this is a forced progression. You can either increase the repetitions by 5 and try again and reassess it, or we can do this. We can grab a bit of cardboard. As you can see, just fold it up, so it's got a little bit of thickness to it. As you can see, you could use anything. You could use a little weight plate, etc. But how good is the cardboard? It doesn't cost you anything. Put the cardboard on the chair. And what you're going to do, you're going to put your toes on the cardboard. Okay, so basically, let's show you like this. So the cardboard is placed here underneath the front of the foot, like so. And what that does, it puts his foot more into dorsiflexion. So we place the cardboard on the chair, like so. That's under the front of my foot, as I explained, which means, say your foot's like that when you first start the exercise with the cardboard, well, from here it just jacks it up a little bit, which is a force progression through the joint. And sometimes a lot of clients and patients need to progress with this format, and some don't. So once again, same thing, nothing changes. Position's right, stay about 89 degrees, all the way forward, don't lift the heel off the ground, don't push your pain, 1, 2, and coming back. And I'd recommend maybe start with 10 and reassess. You know, if it's no better, no worse, go up to 15 with it. If it's feeling better, well, that's your green light to continue. And if you plateau, once again, just increase the repetitions. Or you can increase the thickness of the cardboard. I'd probably go increase reps first. In my experience, normally about 15 to 20 reps has a really good outcome. I'll give you an example. I had a patient this morning, his main complaint was stiff right ankle compared to the left. And get into a squat, you clearly see that his squat was deviating and he couldn't get down as far. I wasn't asking him why. He pointed to his ankle, he said it was very stiff. And this person's a touch rugby player and a very fit young man. So I assessed his ankle first and noticed with assessment it was very stiff compared to the left, with a major loss of motion compared to the left. So we got straight into this exercise, and the difference it made was quite phenomenal. Rapid change. I've got him to do 20 repetitions, and when we remeasured the squat, significantly better. He got deeper and didn't even say anything about the ankle. And believe it or not, he walked in with some unexplained inflammation around the outer part of the ankle. And believe it or not, he walked out with no inflammation at all. So these joint obstructions called derangement can lead to unexplained inflammation. If you would like any further detail on instructions or anything at all, you're welcome to contact me through my website, as I stated before. Or you can call me directly on 0401 548 413, or you can just pop down and see me in the clinic. So I'm based at Health Save Everyday Pharmacy on Lygon Street, 473/475. I offer a complimentary appointment to locals as well. But look, if you're coming from a bit of a distance, I'm happy to honour that to you too. I've got 19 years of clinical experience. I've been studying the body for 26 years, and I don't stop because I love to learn. I think it's very important to learn. I also lecture at Victoria University in the remedial massage program. So I should be able to help, and if I can't help, I will direct you on to the appropriate person to help. So once again, if you'd like to have a chat anytime, just get hold of me and we can go from there. Thanks very much. Have a lovely day.